The Government of Barbados has embarked on several initiatives to transform the economy and improve efficiencies. One such measure is the Health Service Contribution, which came into effect on October 1st at a rate of 2.5%. Minister in the Ministry of Finance, Straughn, explains why it was introduced.
The Health Service Contribution was introduced to help provide a level of financing to the Queen Elizabeth Hospital. Now, over the past few years, the previous administration would have been providing the QEH with less resources than was required basically to operate. And so to the extent that we introduced the Health Service Contribution was to make sure that as we go forward under the program that we're embarking on, that the Queen Elizabeth Hospital, as their primary healthcare facility, would have the financing available for it to be able to carry out its mandate to the people of Barbados. And I think it was really meant to respond to a deterioration with respect to the provision of services. And so therefore we felt that it was important that in addition to government's contribution, that as it relates to employers and employees, that the contribution then comes out on a monthly basis, which will give the Queen Elizabeth Hospital enough time to plan and be able to execute its mandate rather than having to wait on the specific cash flow of government. This is a supported measure such that the hospital will be able to function in a much better way.
Okay. And now it is a contribution. The employers pay some, the employee pays some. Tell us how it's broken down.
Well, the employers will pay 1.5% of your up to your insurable earnings. Employees will pay 1% of their up to in terms of their insurable earnings as well. As it relates to self-employed persons, they too will pay 1% on top of the existing contributions. And so therefore the national insurance will manage, in a sense, that process as is done with all the other funds that are available. But I think the key thing for us is, whilst it is being deducted at source through your national insurance, that we change the legislation to make sure then that those monies then go directly to the QEH rather than come into the consolidated fund.
And that has been a concern of some persons, listening to persons on the radio or reading the papers. Some people are concerned that it will not go where it's supposed to go. What assurance can you give them that?
The public can be assured, because last 2 weeks ago, I believe, we debated in the House and the Senate the national insurance, the amendment to the National Insurance Act, which means then that as those monies are taken out of persons' salaries, that the monies will be transferred directly from the national insurance to the Queen Elizabeth Hospitals.
Okay. How much money is this measure projected to raise, and how long do you expect to keep it in place?
Well, it costs about approximately $200 million a year for the hospital to supply its mandate. And so given that the current provision is about $150 million, we estimate that the measure should raise about $45 million, which will provide about 20% of the hospital's operational budget for the ability to function. And so therefore, within the context of what we're doing going forward, the public expenditure review within the context of the QEH has to be undertaken. And so over the transition period, we certainly expect then that there will be a review of how certain services are delivered, how procurement is done within the context of the Queen Elizabeth Hospital. And so therefore, it is designed to make sure that the financing is in place to be able for the hospital to, one, improve on its service delivery in a very critical way, because this is something that will be, in a sense, permanent, because rather than having to pay for specific services as you go to the hospital, it is designed to make sure that the government, it supports the government's contribution to make sure that the suite of services that we expect to receive from the hospital, that it can actually deliver those services in a way that is satisfactory to the public. All
right, so just to clarify and be clear on this, you're saying that it will be permanent, and you've taken this decision. Is this as opposed to introducing user fees across the board?
Well, I think subject to what the public expenditure review will decide or show up, in a sense, in terms of what we want to be able to provide to the citizens of Barbados, because you've got to look at this in the context of the overall budget and what is it that Barbadians should be able to expect from the healthcare system. And so it's not a function of saying that it wouldn't be user fees specifically. I just want to make that clear. The reality is that the hospital has to undergo a review in terms of the services that we expect to be delivered, having paid this money. Right? And as I said, what we're seeking to do is to make sure, because at the moment, there's also a fund that supports persons going offshore or overseas, as I say, to support their healthcare needs. And so the subject of user fees in this instance hasn't yet been determined from the perspective that we are just trying to make sure that the hospital can raise its standards with respect to what it's currently delivering. And so to the extent that persons are making the contribution at the moment, the review of the mandate of the QEH obviously will be undertaken in terms of exactly what services will be delivered and by whom they'll be delivered. And so the budget is meant to be able to cover those suite of services that ultimately we will expect to be able to get at the Queen Elizabeth Hospital. As you can imagine, there may be some very specialized services, which is what I said, we're trying to leverage the relationships by trying to attract offshore medical institutions on island, such that the service provision of those very specialized areas, that we can marry those two together. And so the health service contribution is meant to be able to provide the hospital with the clearest way of being able to deliver what Barbadians can expect to deliver. I think at the moment, if my memory serves me correctly, there is probably about, in terms of out-of-pocket healthcare costs, what we are spending at the QEH represents probably about 40% of all healthcare expenditures on the island. I speak subject to correction. And so Barbadians are already paying for healthcare services on the island. And so it is the extent to which we integrate the delivery of services at the QEH.
In order to bring effect to this measure, there was an increase in the contribution rates and levies payable to the NIS. 1.5% of insurable earnings will be paid by employers and 1% will be paid by employees and self-employed persons. The Trust Loan Fund was launched on October 29th by Minister of Small Business, Entrepreneurship and Commerce, Dwight Sutherland. It is designed to provide a small cash injection to develop or start a business. The fund will hold a total of $10 million annually and will initially disburse up to $5,000 to applicants.
Working class Barbadians can benefit from access to capital to grow their businesses at a time where access to finance has proven to be a deterrent to business in this country. The goal is to transform the Barbadian economy by focusing on the creation of new wealth and building a more entrepreneurial Barbadian who's empowered and encouraged to take advantage of opportunities at home and indeed abroad. In particular, the Trust Loan Fund was conceptualized by the Government of Barbados, working through the Ministry of Small Business, Entrepreneurship and Commerce and its strategic partners to evolve Barbados into a world leader in entrepreneurial development.
Applications quickly followed, and according to head of the Trust Fund Loan Unit, Jerry Amos, they saw an influx of persons, both applying online and at the Harper Road office.
Anyone that has a legitimate business, existing business, or anyone that has a legitimate business idea that wants to start a business can qualify for the loan.
So you can be employed, unemployed?
Yeah, you can be employed, unemployed. We would want to prefer the unemployed person, but we would take everything on its merit. Okay, as long as we have the applicants in and things are settled down, we are actually going to have training. So when persons come back for the disbursement period, we're going to have a short training session for them. And what we're trying to do is have people in clusters, geographical clusters, where we see how persons within communities can work with each other. For example, you may have someone that is into design, but they don't do web pages. So you would see if you could bring them together, that one person can design the web page and another person can actually write the code for that web page. So we're trying to create clusters in a geographical area. Additionally, the next step will be going on to the Financial Literacy Bureau, where we'll be going into more in-depth training to help persons to understand how to run their business and the financial side of that. What we intend to do is work with our partners, the SBA, Fund Access, YES, UE, to try to have that training experience developed to help these young entrepreneurs. What I want to be absolutely clear on for those out there who are looking to apply is to ensure that they have the quotations for what they need to purchase. We are trying very hard not to give cash in hand to persons because we are trying to also ensure the legitimacy of your business. So that is one step in doing such. What we also be looking to do is to come out to your business to see what you are doing and to give advice as how you can improve what you are doing. What really impressed me with some that I've seen so far is the export potential within some of them. I listened to some persons in the media making comments as to relates to the amount of money and how can it help someone in manufacturing. But what we are not looking at is those who have already started to do stuff that just need that little push to take them to export-based company. Just for example, I have a young lady who is doing tea bags, and she already have her tea bags up. She has like 10 brands of tea bags. They are packaged, and what she just needs is this is an injection to get her to a stage where she can have her packaging in bulk, so that it makes it easier for her, and then we could then move to the next stage of her.
By mid-November, the unit had processed over 800 applicants. We got a chance to speak with some of the entrepreneurs about their plans for their businesses.
Well, I want to expand the business and maybe diversify, but I'm in property maintenance. So we trim trees, fell them, freight, sandstone, whatever. There's a little construction in there. There's a carpenter, mason, so we do that sort of building too, you know? So that sort of thing, property maintenance. And then again too, they said that if you pay back the initial loan, then you will be able to go on and get another one. So if you don't pay back the initial loan, then you're hindering yourself. So what we want to do is get the money in cash, pay it back, and then if you get 5 this time, you want 10 the next time, 15, 20, 25, and keep increasing and growing and building, because we need to employ some people too and expand as much as possible. We have some great ideas out there, but the financial hindrances is what is hindering the...
Well, I'm into event planning, so usually, everybody sees an event planner as just the picture they saw on Pinterest or whatever the case may be, but it's a lot more to it. So right now I'm into like the balloon aspect, the designing and the decor and stuff like that, but I want to actually expand further into rentals, have my own equipment and stuff like that to be able to rent to the general public versus just come in setting up. What I would say is that even though you probably have been given like a lot of hiccups by the banks and other financial resources, I would say to apply, because even if you have it in your head, like just bring out the idea, because it just takes one day or one person to hear your idea and be able to believe in you as well. But first you gotta believe in yourself, obviously. I just think it's a really good program, and I would encourage anybody out there to do it, especially the younger persons who think they have to, have a lot of experience or they have to be over 30 to start a business. I think it's good that you start whenever you think about it.
For more information, visit the Trust Loan Fund Unit, Building Number 4, Suite 102, Harbour Road, St. Michael at trustloanbb.com or call the unit at 231-1633.